Well, hello there, friends and family. I hope this video today finds you all well and your families well and safe. And today will be Wednesday morning, February the 25th. And what we're going to be talking about today, and it's going to start right here on this website, and then I'm going to go to several more. Because what we're going to be talking about is exactly what the U.S. has been so critical of China doing. I think we all know that most countries and most health agencies and officials in all countries feel the Chinese government has not been reporting accurate figures of the severity, confirmed cases as well as deaths outside of China. And that's the topic for this morning. Is the U.S. government and our own Health and Human Services, as well as the CDC, doing some of the same? But before we dive off into that, I want you to listen to the telebriefing that came out today from the CDC. You're going to be listening to Nancy Nassonier, and she's the MD Director for the National Center for Immunization and Respiratory Diseases. Now, I'm not going to play this whole telebriefing, but I will leave a link to it down below the video in the description. And that way, if you want to go back and listen to the whole thing, you're more than welcome to, and I would suggest you do. But what I want you to do while I'm playing this is I want you to listen to not only what she says and what she's talking about, but her tone of voice. Because unlike the WHO, World Health Organization, which has a live public press conference, the CDC is smarter. They're not going to go on live TV and show you what they look like while they're giving their briefing. So let me start this off and we'll listen to it and then I'll be back.
Please be advised that today's conference is being recorded. If you have any objections, you may disconnect at this time. And now I would like to turn the meeting over to Mr. Benjamin Hayes. Thank you. You may begin.
Thank you, Brittany. And thank you all for joining us for today's update on CDC's COVID-19 response. We are joined today by Dr. Nancy Messonnier, Director of CDC's National Center for Immunization and Respiratory Diseases, who will give opening remarks before taking your questions. I will now turn the call over to Dr. Messonnier.
Good morning, and thank you all for joining us. The global novel coronavirus situation is rapidly evolving and expanding. There has been a lot of news coverage about community spread in a few countries since the last time we talked. This means that cases of COVID-19 are appearing without a known source of exposure. Locations with reported community spread now include Hong Kong, Iran, Italy, Japan, Singapore, South Korea, Taiwan, and Thailand. Community spread is often a trigger to begin implementing new strategies tailored to local circumstances that blunt the impact of disease and can slow the spread of virus. The fact that this virus has caused illness, including illness resulting in death, and sustained person-to-person spread is concerning. These factors meet two of the criteria of a pandemic. As community spread is detected in more and more countries, the world moves closer towards meeting the third criteria, worldwide spread of the new virus. The U.S. has been implementing an aggressive containment strategy that requires detecting, tracking, and isolating all cases as much as possible and preventing more introduction of disease, notably at points of entry. We've restricted travel into the United States while also issuing extensive travel advisories for countries currently experiencing community spread. Our travel notices are changing almost daily. We've also enacted the first quarantine of this scale in the U.S. and are supporting the State Department and HHS in repatriating citizens from high-risk areas. We are doing this with the goal of slowing the introduction of this new virus into the U.S. and buying us more time to prepare. To date, our containment strategies have been largely successful. As a result, we have very few cases in the United States and no spread in the community. But as more and more countries experience community spread, successful containment at our borders becomes harder and harder. Ultimately, we expect we will see community spread in this country. It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness. We will maintain for as long as practical a dual approach where we continue measures to contain this disease, but also employ strategies to minimize the impact on our communities. At this time, there is no vaccine to protect against this new virus, and no medications approved to treat it. Non-pharmaceutical interventions, or NPIs, will be the most important tools in our response to this virus. What these interventions look like at the community level will vary depending on local conditions. What is appropriate for one community seeing local transmission won't necessarily be appropriate for a community where no local transmission has occurred. This parallel, proactive approach of containment and mitigation will delay the emergence of community spread in the United States while simultaneously reducing its ultimate impact. To illustrate how this works, I'd like to share with you some of the specific recommendations made in the document I mentioned last Friday, including some of the steps we would take here if needed. This document is called Community Mitigation Guidelines to Prevent Pandemic Influenza, United States 2017. It draws from the findings of nearly 200 journal articles written between 1990 and 2016. This document looked at what can be done at the individual and community level during a pandemic when we don't have a vaccine or proven medical treatment for the disease. We're looking at data since 2016 and adjusting our recommendations to the specific circumstances of COVID-19. But this posted document provides a framework for our response strategy. Based on what is known now, we would implement these NPI measures in a very aggressive, proactive way, as we have been doing with our containment efforts. There are three categories of NPIs: personal NPIs, which include personal protective measures you can take every day and personal protective measures reserved for pandemics; community NPIs, which include social distancing measures designed to keep people who are sick away from others; and school closures and dismissals; and environmental NPIs, which include surface cleaning measures. NPIs routinely recommended for prevention of respiratory virus transmission, such as seasonal influenza, include everyday personal protective measures. These are preventive actions we recommend all the time for influenza season. Stay home if you're sick, cover your cough, wash your hands. These NPIs are recommended during a pandemic, regardless of the severity level of the respiratory illness. Personal protective measures reserved for pandemics include voluntary home quarantine of household members who have been exposed to someone they live with who is sick. Now I'd like to talk through some examples of what community NPIs look like. These are practical measures that can help limit exposure by reducing face-to-face contact in community settings. For schools, options include dividing students into smaller groups, or in a severe pandemic, closing schools and using internet-based teleschooling to continue education. For adults, businesses can replace in-person meetings with video or telephone conferences and increase teleworking options. On a larger scale, communities and cities may need to modify, postpone, or cancel mass gatherings. For healthcare settings, this might include triaging patients differently, looking at how to increase telehealth services, and delaying elective surgery. The implementation of environmental NPIs will require everyone to consistently clean frequently touched surfaces and objects at home, at school, at work, and at large gatherings. Local communities will need to make decisions about what NPIs to implement and when, based on how severe transmission and disease is and what can be done locally. This will require flexibility and adaptations as disease progresses and new information becomes available. Some of these measures are better than none, but the maximum benefit occurs when the elements are layered upon each other. Some community-level interventions that may be most effective in reducing the spread of a new virus, like school closures, are also the most likely to be associated with unwanted consequences and further disruptions. Secondary consequences of some of these measures might include missed work and loss of income. I understand this whole situation may seem overwhelming and that disruption to everyday life may be severe, but these are things that people need to start thinking about now. I had a conversation with my family over breakfast this morning, and I told my children that while I didn't think that they were at risk right now, we as a family need to be preparing for significant disruption of our lives. You should ask your children's school about their plans for school dismissals or school closures. Ask if there are plans for teleschool. I contacted my local school superintendent this morning with exactly those questions. You should think about what you would do for childcare if schools or daycares close. Is teleworking an option for you? Does your healthcare provider offer a telemedicine option? All of these questions can help you be better prepared for what might happen. CDC and other federal agencies have been practicing for this since the 2019 influenza pandemic. In the last 2 years, CDC has engaged in 2 pandemic influenza exercises that have required us to prepare for a severe pandemic. And just this past year, we had a whole of government exercise practicing similarly around the pandemic of influenza. Right now, CDC is operationalizing all of its pandemic preparedness and response plans, working on multiple fronts, including specific measures to prepare communities to respond to local transmission of the virus that causes COVID-19. Before I take questions, I want to address the issue of the test kits CDC is developing. I am frustrated, like I know many of you are, that we have had issues with our test. I want to assure you that we are working to modify the kit and hope to send out a new version to state and local jurisdictions soon. There are currently 12 states or localities around the U.S. that can test samples. As well as we are testing at CDC, 400 samples were tested overnight, and there is no current backlog or delay for testing at CDC. Commercial labs will also be coming online soon with their own tests. This will allow the greatest number of tests to happen closer to where potential cases are. Last, I want to recognize that people are concerned about the situation. I would say rightfully so. I'm concerned about the situation. CDC is concerned about the situation. But we are putting our concerns to work preparing. And now is the time for businesses, hospitals, communities, schools, and everyday people to begin preparing as well.
So the first takeaway here from what she's telling us is she's telling us about community spread and person-to-person spread, and that these meet the first 2 requirements for a pandemic. She then continues on to say, as community spread is detected in more and more countries, the world moves closer to meeting the 3rd criteria or requirement, worldwide spread of this new virus. And that would make it a global pandemic, but she hesitates to say it. But let's take a look at just where we're at today, Wednesday morning, okay? So here we are. We're at the Johns Hopkins website that tracks the coronavirus here in the United States. And you've got 81,005 confirmed cases, 2,763 confirmed deaths. If you look over on the left and you count these countries, as of this morning, it's in 42 different countries. And these 42 countries are in 5 different continents. We've got North America continent with Canada and the U.S. infected. We've got 2 countries now in Africa, Algeria and Egypt affected. That's your 2nd continent. You got 8 different countries in the European continent now affected. You've got many countries now in the Middle East. There's now, let's see, 4, 5, 6, 7 countries in the Middle East are now infected. And then you've got Australia with confirmed cases. That leaves only 2 continents left, folks. That's the continent of South America and Antarctica. And I guess between our own CDC and, of course, that World Health Organization, the WHO, I guess we're not going to declare it until it's at least in all 7. But then she goes on to talk about something else that's extremely important. And she goes on to talk about NPIs. But she doesn't tell us what NPIs are. She just tells us what they may look like here in the U.S. as a pandemic outbreak unfolds and what we can expect to see. But I was curious. I needed to know, what does an NPI, what does that stand for? So I went looking, and this is what I found, and I think this is going to be very important as I explain it to you. Okay, now here we're at PDF file from the CDC, and this is get your community ready for pandemic influenza using non-pharmaceutical interventions. And that's what she was meaning by MPI. And why is that important? Well, let's just see what MPI means. MPIs are actions apart from getting vaccinated in taking antiviral medications that people in communities can take to help slow the spread of respiratory illness like pandemic flu, or in this case, pandemic coronavirus. And what's that mean? Well, she did say right before she went into a lengthy description of the MPI's both personal, environmental, and community that we should be seeing as this continues to spread throughout the U.S., that there wasn't a vaccine currently, or was there current medicines to treat this coronavirus. Now there is one drug, and it's an antiviral that's made by Gilead, and it's called remdesivir. And it was used once so far in the U.S. on the very first coronavirus patient that we had that was being treated at the Providence Medical Center in Everett, Washington. Also, China has duplicated that antiviral drug and is now currently manufacturing it in China and is using it. And they are doing a controlled human evaluation on 1,000 different patients in China right now. It's currently ongoing. They expect to have results within 3 to 6 weeks. However, researchers have said so far it's only proven to be somewhat effective. So we won't know for another 3 to 6 weeks what the effectiveness of remdesivir even is, and will it be something that we can use and is dependable to fight this coronavirus, not only in China but other countries, but here in the U.S. Time will tell. But the whole CDC's plan right now is to mitigate the outbreak of this coronavirus pandemic in the U.S. with non-pharmaceutical intervention, as she explained. But there's another darker side to this. America is currently in a large flu epidemic, and the same medicines to treat the symptoms caused by the flu for the elderly and those with pre-existing health conditions are some of the same that are used to treat the symptoms of the coronavirus, basically pneumonia and secondary infections. So our supplies of drugs, medications are already taxed even before we start to take on the coronavirus here in the U.S. So another thing Nancy Messonnier does not tell us about is why the U.S. CDC is going to combat and confront the coronavirus outbreak here in America with NPIs, or non-pharmaceutical intervention. It's because we have no choice, folks. She knows it, the CDC knows it, and our U.S. government knows it, for the very reason that you're seeing in front of you now. And there are just multiple articles that came out yesterday and today about how the coronavirus in China could cause drug shortages in America. And the reason for that is, over the past 20-odd years, America has become greatly dependent on China, not only for the raw materials to manufacture drugs and medicines in America, but also for finished drugs, medicines, and vaccines from China. The American healthcare system has become extremely dependent on China for medicines, drugs, and vaccines, one of which is antibiotics. 80% of all antibiotics used in America come from China currently. And as we all know, China is basically still locked down. Their factories, what ones are up, are highly understaffed. They're struggling to produce what they need to confront the coronavirus in their own country, let alone ship anything out. When things come to who you're going to take care of, I'm willing to bet China's going to take care of their people first. And I guess I can't blame them either. But we're also dependent on them for basic medical supplies, and a wide range of them as well. And I went to look up medical mask manufacturers here in America to see if we even had any in America. And let me show you what I found. And here we are. We're at another CBS News article that came out this morning, 8:46 a.m. America's largest face mask manufacturer can't keep up with the coronavirus demand. Washington, as international markets are left gasping from the effects of the spreading coronavirus, one American business is struggling to keep pace with the skyrocketing demand for its products. It's a madhouse, said Mike Bowen, Executive Vice President and partner of Prestige Ameritech, the nation's largest surgical mask manufacturer. We're going as fast as we can. Bowen's Texas company, which makes face masks and respirators to protect from germs and filter the air, typically has to pitch their products to hospitals and caregivers, not turn them away. Their American-made products are more expensive than those made by their overseas competitors. Bowen estimates that the demand for the company's more expensive products is about 1,000 times higher than what it is under normal conditions. Phone calls asking about the masks and respirators used to be a rarity. Now the company fields about 100 calls a day. They've heard from hospitals and other healthcare organizations, groups of concerned citizens, worried mothers, even the company's own competitors, all asking for products they can't keep on the shelves. There is no stockpile, Bowen explained, because of the seemingly insurmountable need for more masks. Daily order requests since the outbreak, he said, now range from 1 to 100 million face masks and respirators. And here's the important part. Requests his small business of roughly 100 employees can't fulfill. Now let that sink in, America. This is our largest surgical mask and respirator manufacturer in the country, and it only has 100 employees. It may be the only one in America. It's the only one I could find, and it's the largest. So not only does America depend on China for its drugs, medicines, and vaccines, antibiotics, and much, much more, but it also depends on China for surgical masks, respirators, gowns, protective equipment, protective suits, face masks, and the list goes on and on and on again. So with China virtually still locked down and the looming spread of coronavirus, which any day could break out in America, like it's breaking out now in Europe, the Middle East, we'd be entering the fight with our hands tied behind our backs, with no reinforcements coming. And we're going to scroll down here, and you're going to hear something from the Secretary of Health and Human Services, Alex Azar, told senators Tuesday that the nation has an immense need for the very products Prestige Ameritech manufactures. Asked if the government has enough surgical masks and N95 respirators to protect healthcare workers combating the coronavirus, Azar responded, "Of course not." Did y'all hear that? Of course not. We don't even have enough surgical masks and N95 respirators to protect our own healthcare workers, let alone the population. He went on to say this is an unprecedented, potential, severe health challenge globally. Well, it may be globally, folks, but it looks like it's going to be an unprecedented, severe health challenge for America. So the next issue that Dr. Messonnier discusses is the issue with the CDC test kits. These were test kits that were developed by the CDC to test for the coronavirus in people to see if they were infected or not. And we're right here, and these were sent out on February the 5th. This came out on February the 6th. And it says right here, the CDC developed laboratory test kit to detect the 2019 novel coronavirus, 2019 nCoV. Began shipping yesterday, and that would have been February the 5th. Now understand it's now February 26th, Wednesday. It's taken a while to edit this video and put it all together. I apologize. My point being, it's 20 days later. And she goes on to tell us that right now there's 11 states that can test for the virus. But the problem's being, our 15th case in America was on February the 13th. And since then, we've had no further cases crop up in America. No spread, no nothing. Now, that's with the exception of the passengers that we brought back from the Diamond Princess cruise ship. Now, with them, we've got 57 cases. But here, those in the U.S., not from the Diamond Princess cruise ship, has remained at 15 since the 13th of February. And if you look at what I showed you on what's happening in South Korea, Italy, spread now 8 countries in Europe, 2 countries in Africa. It's in 5 or 6 countries or more now in the Middle East. But here in the good old US of A, we're still at 15. But the problem with these test kits that they sent out on February the 5th was they didn't work. When the laboratories they were sent to, and they were sent to state health laboratories in each state, and to many other countries outside the U.S. But when they went to use them, or did use them, they gave non-inclusive results. They didn't show anything. They didn't work. And like I said, she's saying now there's 11 states. But while I was editing this video and putting it together for y'all, today there was a young man that came on the news, and he tells a whole different story. We'll switch over there real quickly. So here we are. This is CNBC Television on YouTube. And you can see this is February the 26th. And this younger man here is Dr. Matt McCarthy, Assistant Professor of Medicine at Weill Cornell. And what he's saying, and I'm not going to play the video or I'll get a copyright strike, but I will leave a link below in the video description so you can watch it. And what he's saying is, as of right now, we don't have any way to test. But CDC says a test is coming soon. So other than the testing at the CDC, that's all we got right now. Of course now, Dr. Messonnier said we got 11 states. And see, that's where I have a hard time believing her and the CDC and of course our government. And it's just a simple fact that when you look at how this has rapidly spread in Korea, Italy, like I said, it's now in 8 different countries in Europe, 6 or 7 countries in the Middle East. There's just no way we could stay at 15 for all this period of time. 14 days? Think about it. These people, they came back, most of the 15, with a few exceptions. A couple of them were close contact, came back from Wuhan, China, into the States. And when you're coming back, if any of y'all have flown and traveled, you know, you're on a plane full of people that are coming back into the U.S., you're in crowded airports, you get on buses or taxis or what have you. And then you travel back to your home, to your family. No telling how many people you get within close contact to. But here in the U.S., no further spread. Well, could that possibly be because our test kits don't work? And if they don't work, what makes us believe that the same test, and herein lies the issue, the same test is being used at the CDC? What's to say it is giving us accurate results if the same test kits that they sent to state laboratories didn't? So, with that said, even though the test kits that were sent out to the states may not be working, which apparently they're not, because they're going to be sending out some more, and with only 11 states according to Dr. Messonnier, she addresses that issue. And she says, well, overnight, the CDC labs tested and completed 400 tests. Well, is that true or is it not? And here we're at a website, here again the CDC, and this is where they keep up with the number of not only people they've tested, but total cases they've tested. You can plainly see right here, it's 445. And this is not done by day. This is as it says, total tested. Since this has started, we have only tested 445 people in America. Think about that, people. Now understand too, this site also shows, and this is updated every day. It was last update, well, they say it's updated on Mondays, Wednesdays, and Fridays. So it's not every day. It's basically every other day during the week. And what here shows who was tested. And the travel related, those are the people who came back from Wuhan, China. There were 12. The person-to-person spread was 2. Those were the 2. That was an elderly couple in Chicago's, Illinois. Total confirmed cases are 14. Now, remember, I showed you earlier in the video, there were actually 15. 15th being reported on, I think, February 13th. So here again, this number don't jive. And like I said, she said there was 400 that were tested overnight, which would have been Monday night on the 24th. She was doing this here telebriefing on the 25th, but this site still says total tested 445. But then down here it shows you the positive. Wuhan, China was 3. The Diamond Princess cruise ship was 42. The 59 total cases in the USA since this started. with the first case that was in Everett, Washington, at the Providence Medical Center. Now, up until here just today, we were showing on the Wordometer website, as well as the Johns Hopkins website, 57. Well, here the numbers don't jive either. This shows 59. Now, there has been an added case tonight, as I've been going through this video still, and now we're up to 60. But the numbers are not adding up. And this is what happens when you try to lie, you try to misrepresent facts, cover things up, and I get it. It's all about not creating fear and not creating panic. But I do believe we're all smart enough in the United States to understand, if given the truth, we could make the appropriate decisions. Or I'd like to think we could. But I'm going to show you even more on why these numbers do not make any sense. And that's where we're going to be going to next. So, folks, what we're doing in America is we're telling people to self-quarantine when they have traveled to China. When they return to the U.S., they're given instructions that they should self-quarantine. And this article here from NBC News was actually written on the 19th, and we'll take a look at. We're going to come on down here a bit. Okay. Overall, 575 people in New York have been identified as being at medium risk because of recent travel to mainland China, according to the state health department. And one of the many states monitoring travels from China have agreed to lie low for a few weeks out of an abundance of caution. The California Public Health Department said there are more than 5,400 such people in the state. And I'm going to tell you right now, that has greatly increased here in the last few days. In fact, San Francisco alone has got 7,600 people in self-quarantine. In Washington State, we have 745 people that have been asked to self-quarantine. Georgia health officials have identified 200 travelers. The Michigan Department of Health and Human Services said more than 300 people were referred for monitoring. In Virginia, 138 residents are being monitored. They were asked to remain at home and practice social distancing, said Dr. Lillian Peake, the state epidemiologist. She said social distancing means avoiding public transportation, including taxis and ride sharing, and large public gatherings, and staying about 6 feet away from others. Now understand this. They weren't put into isolation when they returned back from China. They were let go to head on home. How they got there? Who knows? Did they take a taxi? Did they take their personal vehicle? Did they take a bus? Did they take a train? Like I said, you can see just how many people these people could come in close contact with just on their way home from the airport, let alone getting home and being close to their family and their friends. A total of 27 people are under voluntary self-quarantine in Iowa. North Dakota has 10. And here's even a more depressing thought. Health officials in my state of Alabama, then Indiana, Massachusetts, Texas, are also monitoring travelers, but they declined to provide exact numbers, which change daily as passengers continue to arrive home or finish their 14-day self-quarantine periods. So, we're still on the 14-day self-quarantine period. And as you may know or may not know, it has been proven that there are cases that have had an incubation period of 24 to 27 days. But America, we're still going with the 14. And I hope and pray that works out. And they go on to say here, how does voluntary self-quarantine work? Voluntary self-quarantine is different from mandatory federal quarantine imposed on Americans and family members who were evacuated from China's Hubei province or the Diamond Princess cruise ship. Rather, it applies to U.S. citizens returning from the parts of China upon their return. The travelers are screened at the airport for any symptoms of the illness. If they have none, they are allowed to finish their journeys home. Travelers are also asked to provide contact information, which is passed along to local, state, and health departments for follow-up. See what I mean? About how many people they could have possibly exposed from the airport to their homes. We're asking everyone who's been in China in the last 14 days to stay home, monitor themselves for symptoms during the 14-day period. A spokesman from the Texas Department of State Health Services said in the email. It's up to state and local health departments to decide how to manage residents under self-quarantine. In Westchester County, a representative checks in on travelers daily, usually through video conferencing. They develop a plan to make sure the person doesn't need to go out into the community and has resources to get deliveries of food, prescriptions, and other basic necessities. No, so basically, we're self-quarantined on the honor system. Now, how many ways can that not possibly work? The health officials also asked the person to take his or her temperature and report any symptom, both physical and psychological. Testing for the virus is part of self-quarantine. The Centers for Disease Control and Prevention tests people only if they're showing symptoms. Being under quarantine, even if it's voluntary, can make a person depressed or fearful, said Amler, the Westchester County Health Commissioner. It's very important that they know that they have access to mental health professionals should they need it. So maybe it's just me, but I can see so many ways this is going bad. And this is just a few of the states. There's reports coming out of Florida that there are people in quarantine. Reports out of South Carolina, North Carolina, other states as well. But here again, just like this says, the CDC isn't testing any of these people. They're only testing people with symptoms. More so, they're only testing people with symptoms that have a history of travel to China in the past 14 days. So there's not, and that's the importance of this video. Why I hope you will listen to the telebriefing on the 25th with Nancy Messonnier. I'm also going to provide a link for the telebriefing that was on Friday, the 21st, because that can show you what they said then against what they're saying on the 25th. And you can see the whole mood and context of the telebriefing's change from the 21st to the 25th. It also addressed the issues of the test kits. How many states had test kits on the 21st? And now magically, how many states have test kits that supposedly work on the 25th? And this is my whole point. I do not trust the numbers in America anymore. They don't make sense as how this is evolving in the rest of the world. Italy blowing up, South Korea blowing up, Iran blowing up. Over the last couple of days, it's spread throughout Europe. It's in Africa, the Middle East now. And, as me sitting here running my mouth, tonight, there is the first case on the South American continent in Brazil. So yes, now, there are 6 of the 7 continents with confirmed cases on. But as of yet, the World Health Organization, I refer to it as the Worthless Health Organization, and our own U.S. CDC, has yet to come out and declare this a pandemic. I was hoping tonight, when I saw the live feed pop up, where the President, Vice President, and our health officials from the CDC, from Health and Human Services, were going to hold a press conference to brief the nation. I was hoping then we were going to declare this a full-blown pandemic, and we were going to tell America what we were going to do to control the spread, treat the people. And all I saw, and this is not political in any way, all I saw tonight was a cheerleading session of how well we've done, because we only have apparently 15 cases out there, folks, if you exclude the ones we brought back from the Diamond Princess. But understand this, all the people we evacuated and brought back from Wuhan, China, have now been released back to their jobs and their homes and their daily lives in America. And that was only after a 14-day quarantine. Out of all those people, nearly 1,000, were there any of those outliers where the incubation period is taking 24 to 27 days? We won't know yet, but we'll know in a few weeks. And that's why this is so important. You have to listen to the people. And that's why I wanted you to listen to Dr. Messignier, and you'll probably get a better grip on this if you go ahead and listen to the telebriefing on Friday the 21st. Because like I say, the whole mood and context changes in a matter of no more than 4 days. So, what can we all do? And I read all your comments in the video. I would like to respond to all of them, but I'm sitting here watching every video that pops up, every news feed, reading every article, and that's taken on a given day anywhere from 12 to as much as 16 hours. There's no time for me to answer comments. And I'm doing this, yes, first of all, for myself, for my children, my grandson, my friends. But I'm also putting it out there for all of my friends across the country, in so many different countries. I have people now in many countries watching me, and I'm sure that they're all wondering what's going on. And many of those people in those countries, they look to America to be the leader, to take the lead. We're supposedly the best, or at least we think so. So if anybody could beat it, you would think we could. But that's where this is all starting to become suspicious. And I do get why our government, why our Health and Human Services, our CDC, and all of them are trying, and I don't say lie, but maybe suppress information to the general public. And it's all about making sure, and it's all about keeping the public calm, not creating fear and panic. Because as of this Monday, 24th of February, the stock market took a 1,000-point dive. It took another 876 dive on Tuesday. And today, Wednesday, it just didn't recover. Everybody thought it would, but it didn't make it. And who knows what tomorrow will bring. So folks, all I can tell you to do is do your own research. I'm going to leave some links. More than glad to listen to them. Go to the sites. Decide for yourself. Me, I'm preparing. And I'm preparing to lock down and stay here in my little place for as long as it takes till it either dies off or some type of treatment is made available. In my mind, that's all we can do. So y'all, I hope you found what I presented tonight in this video interesting, informative, and I hope you can use it to make your own decisions. And like I said, I know from the comments, all of y'all out there are preparing the best you can. Some of you have spent all you got already. Others don't have much. But this is also what I would like to bring up before I leave you tonight. I'm hoping and praying that should this turn bad, that we as a people, instead of acting out, hurting others, we will come together and help each other get through this and survive another day. Folks, until I see you on the next video, I want you all to take care. Stay safe out there, whatever you're doing and wherever you're at. Prepare the best you can. Do the best you can with what you got. I do think there's power in prayer, regardless of the religion that you choose. Now's not a time for politics or religious bias. Now's a time that the people of the world should come together. So y'all, I'd like to bid you a good night. May God bless each and every one of you and your families. I'll see you again. Goodbye for now.